The outcome tab is just as it sounds. It's the outcome of the call itself. So we start with the top here with patient disposition. A few different options here, which we've probably seen when utilizing other software programs. What I can say about these is utilize them as you see fit for each call. Since this particular software program currently does not offer a multiple patient release option, my recommendation when documenting multiple patient releases is when you input a patient, select no treatment required. And what that allows you to do is document your patient without having to put in vital signs. There is an assessment required, but there is limited things that you have to fill out on that assessment. So that's your best option and really what you should be clicking if you're documenting a multiple patient report. Type of service is defaulted since most of us do 911 response. Level of care is defaulted. Barriers to care, if for some reason you need to document as such. If there is a delay, there is a rule within the program that after a certain amount of time it will require a delay reason for this item. So if you get a closed call rule when you're trying to complete your patient care report and it's requiring a destination delay, that's because for some reason it fell outside that time frame window. Canceled reasons, how the patient was transported from the ambulance to the hospital. What I can say from an education standpoint is that really the only way that a patient should be coming in from an ambulance is by stretcher. When you document something else such as assisted, walked, or carried, for instance, leaves room for litigation, things of that nature. So a stretcher is the best way to transport our patients to the ER. Disposition, we default this to not known because we're always not going to know exactly what happened to that patient. Same with hospital. These are NEMSIS requirements, believe it or not, but we put those as not known. Protective equipment used, gloves and eye protection is defaulted. There's other options if need be you can select. Transported, how we transported the patient. You can multi-select this, so if when you got there you had to move the patient through a stair chair down to your stretcher, or you had to use a backboard or a PD-PAL, you can select multiple different items if need be to document what's used on that call. How they're positioned during transport, condition, transport mode. If we had changed priority, document here. If there's a delay, again, just like our destination delay, if a scene delay occurs or a transport delay occurs over a certain time frame, it will request you to answer this question. Currently it's defaulted to none. Transport agency. I know it seems strange, but this is if you have a patient you're handing off to another department or a private ambulance, aeromedical, something of that nature. You can document who you gave that patient to. Destination reason. Yeah, I'll just select this here. Again, here's our list of facilities. You saw this when we were selecting our pickup address, our scene address, as well as our home address. So it's the same list. This is kind of where it pulls from. Facility department. This is important when we're talking about faxing the report at the hospital. If I select Edward Hospital, I need to select the department which we transported the patient. Now, eventually this will have pod A, B, and C in here, but for right now we have emergency department which we'll select. And what that does is the program now knows that it is to fax this to the emergency department. Once we have all the different pods set up, please select the department. Same thing with Central to Page. You'll see that they have pods A, B, and C here. So we can select that. Once I close it out and save it to server, it will then fax it to their pod. That's why this field is important. The rest of the information gets filled in automatically. And we'll move on to our times. As I stated in the first video in regards to trip, when we first open our patient care report to start documenting, you can come to the Times tab and input your times. Currently our times do not automatically transfer over from CAD to this portion of the report, but hopefully at some point in the near future that will occur. So what it does by putting these in first is when I do my patient assessment, vital signs, interventions, my timeline is already mapped out. So it's a benefit at first when you come to your reports, come to the Outcomes tab, come to the Times tab, and input some times. So for the sake of this, let's just put in a few times. Once I put the first one in, I get my little menu of options here. Dispatch notified, unit dispatched, en route, on scene, at patient side. Let's see, we depart scene at this time. Got to the hospital here, we're in service and back in district. Okay, so we have all our times documented here. Moving on to signatures. What this menu is used for is recording both HIPAA forms and also refusals. Clicking on the add, you'll see I have a list of different things to choose from. Currently I'm logged in under Warrenville Fire Protection District, so it gives me their forms. I have HIPAA, patient unable to sign, and the rest of them have to deal with refusals and on-scene physician. If your patient is signing the HIPAA, click the first one. If anybody else, power of attorney, the parent of a child is signing, have them click patient unable to sign. So we'll start with this one. We'll click self because it's the patient. The name of signer will automatically populate if it's already input on the patient side here. First name, last name. Once I do that, I'm allowed to input a signature. This simply gives us information that our traditional HIPAA forms, have them read it and click accept. They can then sign here. With the tablets, it's a little bit easier to sign on the screen as opposed to me who's using a mouse to do so. Click OK. Here we would not document a reason since the patient themselves are signing. Witness name and phone if need be. If you feel the need, you can put that in there. If I need to add another signature for some reason, I can do it down here. We'll do that so we can show unable to sign. So person signing for this one, this is the patient is unable to sign, so put in whoever. If it's the hospital, if it's a nurse, click here. They'll put their name in. A different form that corresponds with the patient unable to sign language. Sign here. And document the reason. Witness name if need be. Now if I want to document a refusal, I click the add here. And you notice I have the different types of refusals here as well as the on-scene physician. These are the same as our previous refusal forms with different lines for people to sign at and initial next to, etc. I will say a couple things differ with hospital bypass and intervention/procedure, and I'll click on it and show you why. And put some information here. Now you'll notice that the wording is all the same as our previous forms. However, we document here as C narrative. The reason being this form does not allow for a pull-down menu. We can do a free text field behind the scenes and that's about it. So document in your narrative where the patient was refusing to go and where they wanted to go. They'll accept it. They'll sign it. If we want to document a procedure they're refusing, it's the same situation. Down at the bottom it says C narrative. So we'll simply put in our narrative what it was they're refusing. If they're refusing to sign, you can document so here, and then a witness if need be. The rest of these are essentially boilerplate when it comes to our previous refusal forms. The only two that really differ that we have to put something in the narrative for is hospital bypass and intervention/procedure. Moving on to exposures. The exposure simply allows me to document an exposure that occurred on scene. So a needle stick, fluid that got in somebody's eye, a bodily fluid, something of that nature. Document your person on the scene, the exposure type, and if the supervisor was notified. This does not take the place of any department procedure you may have in regards to notifying people, so definitely follow your own department policy for exposures in the field, but just allows you to document in the narrative or the report itself any exposure that may have occurred on scene. That's it for the Outcomes tab. Next, we'll talk about review.